Welcome to the deep dive. So get this. The global digital healthcare market. It was valued at just over $100 billion back in 2021. But the projection, it's set to absolutely explode to nearly $1.3 trillion by 2033.
Trillion. It's hard to even wrap your head around that scale.
Exactly. It's not just, impressive growth. It feels like a fundamental reshaping of how we all interact with health. So today we're taking a deep dive into this fascinating world of the global digital healthcare market. Our core mission really is to understand just how fast this market is truly growing. And what do the regional trends tell us about where innovation and adoption are really taking off? And maybe most importantly, what does it all mean for you?
Yeah, that's key.
Our insights today, they come straight from official research by Cognitive Market Research. So we're here to unpack these, frankly, formidable numbers, pull out the most important nuggets of knowledge, and basically give you a shortcut to being really well informed about this incredibly fast-moving sector.
And, understanding these figures, it goes way beyond just market values. It's really about grasping the future path of patient care and public health globally. Digital healthcare isn't just like a tech upgrade. It's a profound shift, a systemic one. These projections, they really illustrate this widespread embrace of technology in a sector that, let's face it, touches every single one of us. It points to a future where access, management, delivery of health services, it's all going to look very different.
Hey, let's unpack this then. Let's start with the big global picture. Can you set the stage for us with those headline numbers? What's the overall trajectory we're looking at?
Certainly. So the digital healthcare market, like you said, started just over $100 billion in 2021, $102.556 billion to be precise.
Right.
But what's truly remarkable is the projected surge. It's set to hit $238.5 billion by 2025.
Okay, more than double in 4 years.
Exactly.
Yeah.
And then it just soars to a monumental $189.860 billion, almost $1.3 trillion by 2033. This represents a compound annual growth rate, the CAGR, hovering right around 23.49%. Let's call it 23.5%.
Wow. Nearly $1.3 trillion from just over $100 billion in, 12 years. That is a monumental leap. What do you think are the main drivers? What's enabling such a rapid shift? I mean, healthcare's traditionally been kind of slow to adopt new tech,
Yeah,
right?
that's a fair point.
Is it just investment pouring in, or are things like regulations changing or patient demand playing an equally big role here?
It's a great question. And it's definitely multifaceted. It's not just one thing. Investment is certainly fuel, no doubt. But we're seeing this powerful combination of factors coming together. Think about the rapid advances in, say, mobile tech, AI. Widespread internet access is huge. And maybe most crucial, a growing demand from patients, from us, for more convenient, more accessible, more personalized care.
Right.
And of course, we can't ignore the pandemic. That acted as an undeniable catalyst, didn't it? It forced healthcare systems everywhere to rapidly embrace remote solutions, digital platforms.
Absolutely, yeah, a massive accelerant. And that scale of growth, it leads us perfectly into the regional breakdown. Because, as impressive as those global numbers are, the real story is often in the regional nuances. Some places are just lighting up the growth charts way faster than others. So let's start with North America. Historically, it's been a digital healthcare powerhouse. But what's really compelling is how it's not just maintaining that, it seems to be accelerating its dominance.
That's exactly right. North America continues to be dominant. It was valued at around $46.3 billion in 2021.
Okay.
And is projected to exceed $500 billion, hitting over $558 billion by 2033. It's sustaining a really strong CAGR, too, just over 23%, 23.051% to be exact. This significant sustained growth, especially in an already pretty mature market, it points to continued really robust investment in health tech. Plus, you have high patient adoption rates driven by strong digital infrastructure and innovative care models already in place.
And within North America, obviously the U.S. is the biggest engine. It's set to reach nearly $447 billion by 2033. That's $37.5 billion in 2021, going up to $446.975 billion.
Massive.
But it's interesting, Canada and Mexico are also showing equally robust growth. Canada's CAGR is actually a bit higher, almost 24%. Mexico's around 23.3%.
Right. Canada, $4.96 billion to $64.8 billion. Mexico, $3.8 billion to $46.7 billion.
So it really highlights a continent-wide embrace of digital health, doesn't it? Not just a single country thing. What lessons do you think other regions might take from North America's sustained leadership here?
Well, a key lesson from North America, particularly the U.S., is probably the power of a dynamic private sector working alongside or sometimes pushing evolving regulatory frameworks. There's a willingness to invest invest heavily in R&D, you've got the tech giants there, and a regulatory environment that, okay, it's sometimes complex, but it has increasingly adapted to digital health innovations. So other regions might look at how to foster those kinds of innovation ecosystems, but also, crucially, how to ensure equitable access. That's always the challenge.
Good point. Okay, moving across the Atlantic. Europe, also a very strong presence in this digital transformation. What's the picture looking like there? Any specific drivers we should note?
Europe represents a really significant chunk of this market. It was valued at nearly $20 billion in 2021, $19.896 billion, and it's projected to reach around $235 billion by 2033. The CAGR is just under North America's, but still very strong at nearly 23%, 22.909%.
Still very impressive.
Definitely. And what's fascinating here are the varying paces of adoption within the continent. Germany, for instance, is projected to lead Europe by 2033, almost $54 billion. Its CAGR is actually slightly higher than the European average, around 23.7%.
Interesting. Why Germany, do you think?
Likely reflects its robust digital infrastructure, maybe more progressive regulatory frameworks around e-health specifically. BA comes to mind. The UK and France are also standouts. Projections over $36 billion for the UK, over $33 billion for France.
Yeah.
But then you compare this to, say, Russia with a CAGR around 21.3%, or Switzerland around 22.1%. It suggests different national strategies, maybe different levels of digital readiness, or perhaps varying hurdles around data privacy across the region.
Right, those internal variations are key. Okay, now, here's where it gets really interesting. As you hinted, Asia-Pacific. This region is truly the growth engine, isn't it? Projected to have the highest regional KGR of them all. What makes APAC such a standout?
Asia-Pacific's growth rate is remarkable. The regional CAGR is almost 24.8%, nearly 25%.
Wow.
It started from a value of around $21 billion in 2021, $21.127 billion, and it's projected to hit over $300 billion by 2033, $300.537 billion.
So bigger than Europe by then.
Projected to be, yes. What makes APAC so compelling? It's a combination. Again, you've got a massive, often digitally native population, rapidly increasing smartphone use, and in many places, there's a need to kind of leapfrog traditional healthcare infrastructure, maybe due to geography or just existing limitations. Digital solutions offer a powerful way to deliver care more widely, more efficiently in those contexts.
And within APAC, China's projected to be the largest single market, right? Expanding from about $6.3 billion to over $91.5 billion. That's a 25% CAGR itself.
Correct. China's huge. $6.296 billion to $91.514 billion.
But the absolute standout, highest CAGR among the major countries globally is India.
Yes.
It's rocketing from just $2.5 billion in 2021 to a projected $39 billion by 2033. That CAGR is incredible, almost 26%.
25.963%. It's incredibly telling. It paints this vivid picture of a nation just actively embracing digital solutions to try and democratize healthcare access.
Makes sense.
This rapid adoption, it's fueled by, well, a massive young digitally savvy population, widespread smartphone usage, even in rural areas, plus government initiatives actively promoting digital health platforms to bridge those gaps in care delivery. It highlights just an immense opportunity for innovations tailored to scale to reach vast numbers of people.
That's fascinating. And beyond India and China, Japan, South Korea, Singapore also showing strong growth.
Absolutely. Japan is projected to go from $3.7 billion to nearly $50 billion. South Korea from $1.8 billion to almost $24 billion. Both with KGRs over 24%. And Singapore, while smaller, has a TGR over 25%, similar to China. So yeah, robust growth across several key APAC economies.
Okay, so if we connect this to the bigger picture, we see this strong, impressive growth across other key regions too. It really underlines that this is a global phenomenon, not just confined to North America, Europe, and APAC. Can you walk us through the, let's call them emerging powerhouses, South America, the Middle East, and Africa?
Yes, absolutely. These regions, maybe starting from smaller market bases currently, are definitely poised for remarkable expansion. Their growth rates are incredibly strong. Take South America, projected to grow from roughly $5.8 billion in 2021 to over $76 billion by 2033. That's a KGR of almost 23.9%.
Very strong.
And within South America, Argentina stands out. Its GAGR is particularly high, around 24.4%. That suggests really aggressive digital adoption, maybe driven by a need for more efficient healthcare delivery across its, varied geography.
Right. And the Middle East.
Also showing significant promise, going from around $5.5 billion to over $71 billion. The KGR there is about 23.7%. Countries like the UAE and Turkey, both with KGRs around 24.2 to 24.4%, seem to be leading the charge, likely driven by, significant government investment in things like smart city initiatives and advanced healthcare infrastructure.
Makes sense. And Africa?
Africa started from around $3.8 billion in 2021, but it's expected to reach over $48.5 billion by 2033. That's a solid 23% CAGR. And within the continent, countries like South Africa, going from $1.3 billion to over $17.7 billion, with a KGR near 23.8%. And Nigeria, from $0.66 billion to over $8.6 billion, CAGR around 23.3%. They demonstrate strong growth, showing the real potential of mobile health solutions in diverse and often underserved communities.
So, okay, let's try and pull this all together. What does it all mean? It clearly shows, as you said, North America and Asia Pacific are projected to be the real titans of the digital healthcare market by 2033, size-wise,
Right.
with Europe holding a very strong third position.
Precisely. And when we look at the fastest growth drivers, it's not just about who's biggest now or will be biggest overall. Asia Pacific as a whole, with countries like India and China really pushing that average up, right, alongside South America and Argentina specifically within it. They're showing the most rapid rate of expansion. These high CGRs, they're not just numbers on a page. They signify massive opportunities for innovation, for investment, for transformation, particularly in areas that might be leapfrogging those traditional healthcare models we talked about.
So what it really tells us then is that this isn't just some localized trend or a niche technology play. The data paints a picture of, well, ubiquitous and rapid growth across virtually all the regions and countries we looked at. It's a fundamental global shift towards digital healthcare that's happening basically everywhere, all at once.
Exactly. And for you, the listener, this rapid digitalization, it's likely to profoundly impact your future interactions with healthcare, no matter where you are. Think about telehealth services connecting specialists in cities to patients in remote areas, or remote monitoring devices tracking vitals from your own home, or even AI-powered diagnostics giving earlier insights. These market trends, they indicate a future where digital tools will just be increasingly central to how healthcare is delivered and experienced. It's about more convenience, hopefully more access, and often the potential for more personalized care.
It really is incredible to see these numbers laid out and just think about the wave of innovation they represent. This market isn't just growing, it feels like it's truly redefining what healthcare means for billions of people globally. So maybe a final thought to leave everyone with. Given these staggering projections for digital healthcare growth, what innovations or maybe shifts in accessibility do you foresee becoming commonplace in your daily life over the next decade? Things we might not even fully grasp today. Welcome to the Deep Dive. Today we're plunging headfirst into a really dynamic space, the digital healthcare market.
It's definitely evolving fast.
Absolutely. So our mission today is to sort of unpack the key dynamics, the trends, some surprising ones, and, well, the big hurdles based on the latest analysis you've shared. Really hoping to get some essential insights out.
And it's fascinating, isn't it? The sheer scale of this change. I mean, technology isn't just tweaking healthcare anymore.
No, not at all.
It's fundamentally redefining how you access care, how you experience it. It's pushing us into, well, a whole new era.
So what's really fueling this massive shift, I think one of the biggest things we're seeing is the explosion in telemedicine and remote monitoring.
Oh, definitely.
And this next stat, it really makes you stop and think. Virtual consultations, they went from just, what, 11% pre-pandemic?
Something like that, yeah.
To around 46% during the peak. But what's really telling is even now, somewhere between 35% and 55% of both doctors and patients are still using these digital channels.
Right. It's sticky.
Exactly.
Yeah.
It's not just a temporary fix. It feels like a permanent behavioral shift, you know? Digital convenience is now an expectation.
And building on that, you see how it connects directly to other big pressures, like the growing burden of chronic diseases, the aging population globally. It creates this rising demand for solutions that let care happen outside the hospital, continuous care. So remote options become, well, essential. Not just nice to haves.
Right, essential infrastructure almost. And behind a lot of this, powering it, is the integration of AI, IoT, wearables.
Yeah, the tech side is huge.
Think about your smartwatch, right? It's not just steps anymore. It could be actively feeding into your care plan.
Right.
Over 35% of health apps apparently have AI built in now.
And the Internet of Things, basically devices talking to each other.
Like those wearables, yeah.
They're transforming how we collect data in real time.
Yeah.
It lets you be much more active in managing your own health. We're moving away from just occasional checkups to something more continuous, more proactive.
But all that data flying around, that must bring up some big challenges, right? Especially around keeping it safe.
Absolutely, it does. And that leads to a really important question. What are the roadblocks here? The big ones.
Security has to be top of the list.
It is data privacy, cybersecurity. These are major concerns. Nearly half of providers say they're very worried about breaches, and alarmingly, somewhere between 32% and maybe 59% of healthcare organizations, they've actually faced some kind of cyber threat.
Wow, that's a lot.
It's a very real, persistent challenge. It really threatens the trust people need to have in digital health.
And beyond security, what about actually making the care seamless? Does the tech always work together?
Well, that's another major hurdle. System interoperability. Getting different systems like electronic health records from different places to actually connect and share information.
Right.
Around 47% of institutions say they struggle with that. It hinders the smooth flow, creates data silos, instead of that complete patient picture you really want.
Yeah, you end up with fragments instead of a whole view. And then there's the cost, right? Implementing all this isn't cheap.
Definitely not. High implementation costs are a barrier. And we also can't forget about digital literacy gaps.
Especially in, say, rural areas.
Exactly. That can really slow down adoption and honestly widen the gap in health equity.
Okay, so hurdles are clear. But despite those, you mentioned trends pointing towards a smarter future.
Yes, definitely. We're seeing significant growth in value-based care, but delivered at home. Think remote patient monitoring, digital tools, therapeutics for chronic conditions like diabetes or heart disease.
So making it more personalized, more accessible right where you are.
Precisely. Moving care closer to you.
And AI keeps coming up. You mentioned automation.
Huge impact there, too. From making billing less of a nightmare to helping out with diagnostics, generative AI specifically is boosting efficiency, cutting down operational overheads. It's about making the whole system work smarter, not just harder. And if you connect that to the bigger picture, infrastructure-wise, we're seeing a robust expansion of anything as a service, AIs, and cloud-native platforms.
Okay, break that down a bit.
Think of it like subscribing to essential healthcare software or infrastructure instead of buying and managing it all yourself. This even includes things like disaster recovery as a service.
So ensuring the systems stay up and running securely, even if something major happens.
Yeah, exactly. It's about building these really adaptable, resilient foundations for secure, flexible digital health operations, sort of future-proofing things.
Okay, it really feels like this whole transformation, despite the challenges, is paving the way for a digital healthcare ecosystem that's, well, smarter, hopefully safer, and definitely more responsive to what we all need.
It's a profound shift. Less evolution, more revolution in how we think about health.
It really is.
Which leads to, I think, an important question for you, the listener, to consider. As all this digital health stuff continues to evolve, what new responsibilities, but also what new opportunities might pop up for you in managing your own health data? And maybe in advocating for the kind of digital care you want. Something to think about.